Welcome back to another edition of Get Well Acadiana with Dr. Kevin. Thank you so much for joining me on the show today. I really appreciate all of you spending your Saturday morning to learn some of the latest advances in natural health care. The purpose of this show is not to just be something interesting to listen to, but is to show you the pathway to improve your health and to improve your future so that you can live a longer, healthier life. And that's my goal for being here every Saturday morning. And I've got a good one for you today. Today's show is going to be about something that plagues so many people out there in the Acadiana area. And so today I wanted to have a serious discussion with you about chronic pain. And chronic pain has many names. It doesn't matter what you call it. You could call it fibromyalgia or arthritis or migraines or rotator cuff. It really doesn't matter what name you've been given. Pain is something that you want to pay attention to, and not enough is being done to help people that are suffering. And the truth is, we're not even getting to the solutions or really even to the underlying problems to help these people. And it's so easy now just to cover up pain with medication and ignore it, but that is not a good idea. Opiate addiction has now become an absolute epidemic, and I see this every single week in my practice. Opiate addiction has gone up 500% in the last 7 years. And, we think of the person out there that's addicted to opiates as some person down an alley somewhere. And that's actually not the case at all. It's the grandmother who's just trying to live her life without pain, or it's the dad who had a knee injury in high school and is now suffering every day, or the mom who just wants to be able to work without her headaches. These people are just trying to live their life without suffering, but because opiates are so addicted, now it's gotten to the point where, unfortunately, they can't stop. And I see regular folks every day who are suffering and who are now dependent on these pain medicines. And if anyone out there listening is having these problems, just know that we're here for you and we have solutions for a lot of these things, and that you don't have to continue to go down this road. And the other thing that I see is a very high overuse of over-the-counter medications, the aspirins and Tylenols and Advils. It says right on the box that not to take these things more than, sometimes 7 days. And the other thing is people say, well, 2 helped a little, so I'll take 6. And this is very damaging on your liver and kidneys. So here's what's so absolutely frustrating about this. The pain that you feel is not even what's wrong with you. A symptom, the definition of a symptom, is a sign that your body sends you telling you something is wrong. It's not what's wrong, but it's telling you something is wrong. It's like your check engine light on your car coming on telling you there's a problem. So if you're driving home from work today and your check engine light comes on, that's not what's wrong with your car. You couldn't put tape over the dash and fix it. There's the check engine light is telling you that damage is being done. And that is the definition of a symptom in our body. It's your body telling you tissue is being damaged. If I touch a hot stove and I feel pain shooting up my arm, well, I could inject pain medicine in that nerve so that I didn't feel it anymore. But that wouldn't make a lot of sense because that's not fixing anything. That's not stopping the damage. Symptoms are a sign of a problem. They are not the problem. So we've got millions and millions of people addicted to drugs to cover up a problem because no one has sit down with them and figured out a common sense strategy, a solution. And listen, just because one doctor can't resolve your underlying conditions causing your pain doesn't mean that someone else can't. One of the things that's always bothered me when patients come in and go, oh, my doctor said that nothing could help me and I just have to live with it. No doctor can tell you that. That's not possible. There's no way that doctor knows every treatment on the face of the earth and how you're going to respond to each individual treatment protocol from every treatment on the face of the earth. It's just not possible. No doctor can say that. So today, I'm going to lay out 5 new technologies for chronic pain and suffering that you've probably never even heard of, but are tremendously effective at solving all types of chronic pain. And the other thing that I see all the time is patients don't even want to admit they have chronic pain. Guys, listen, I've consulted, in fact, I've consulted over 10,000 patients in the last 22 years. And I see this with patients all the time. I'll say, tell me about your chronic pain. And they go, oh, I don't have chronic pain. Well, how long has it been there? Oh, 6 months. And how often does it occur? 3 or 4 days a week. Well, guess what? That's chronic pain. But it's like we don't want to admit that we're a chronic pain sufferer. But you do. That is what it is. It's chronic pain. It's unrelenting pain that you have not been able to address. And people don't want to admit that. One of the biggest problems that I deal with in practice every day, in addition to trying to figure out the physical solutions for these very complex health problems that we treat, but in addition to that, one of the other biggest problems that I deal with is that people don't really want to take their health problems and look at it for what it really is. It's called minimizing. People use minimizing statements so that they don't have to admit to themselves that their health problems are an issue that needs to be addressed. They'll say things like, oh yeah, I have that, but it's not that bad. Oh, it just happens a few days a week. It's not that big a deal. Well, if the brakes on your car stopped working for a few days a week, would that be a big deal? Or they'll say, oh yeah, but I have headaches because of my job. Well, if that were true, everybody with your job would have headaches, but they don't. And so people use these sort of minimizing statements to try to make their problems less than what they are. And that is not the pathway to a long, healthy, functional life. Part of my job as a physician, as a wellness advisor, is to get people to take their health problems out of hiding and take a real look at it for what's truly going on with their health. And if you always minimize what's actually going on in your body, then you're probably going to end up in real serious shape later on down the road. And the truth is, the average patient that comes to us, the challenge is not finding out where their problem is. The challenge is they have so many problems going on, it's hard to know where to begin. They have so many different layers of injuries and problems and issues, it's really hard to know which one to start with. And so it's really unfortunate that we see these type of things go on and that we see so many people suffering with chronic pain. And what happens is something that we call behavior adaptation. What behavior adaptation means is this. Well, doc, I used to love planting a garden and enjoy working in that every day, but I don't do that anymore. I just can't do that. Well, doc, we used to love to go dancing. I used to go dancing with my spouse all the time, but I can't do that anymore. Oh, I used to love playing in the yard with the grandkids, but I can't do that anymore. And pretty soon, they've adapted themselves out of everything that makes life enjoyable for them. They're basically just existing. And just existing is no way to live. Guys, we're only given a certain number of days here on this planet. And to spend out of 7 days in a week, to spend one of them or two of them or three of them or, my gosh, more than that, not doing things that you can do because of health problems is such a shame, especially when natural solutions exist to help you. It's just no one's taken the time to sit down and develop a comprehensive strategy to solve these things for you. And there also may be some of you out there that it hasn't gotten this bad yet. Maybe you're starting to have pain and you haven't found a solution for it, but it hasn't gotten to this extreme. Don't let it get to that extreme where it becomes disabling. The sooner we get to problems, the easier they are to address. Don't let it get to the point to where you start adapting your lifestyle around it or have to cover it up with pain medicine every morning. If you have pain and no one has solved it for you, I don't care what the cause is, and I don't care what it's been labeled at, rotator cuff tears, arthritis, migraines, whatever the label you've been given, my favorite, bone on bone, I don't care what you've been told that you have. There may be some natural solutions out there that you have not found yet. So don't just give up and say, yeah, I'm just getting old or this is just part of life. It may not be the case. So I'm going to give you several amazing new solutions on the show today. So stay tuned. And if you're interested in talking to me personally about your chronic pain, I'm doing complimentary phone consultations all this week on chronic pain. I'd be more than happy to call you back Monday whenever I get back into the office to see if I think my methods might be able to help you. And if I don't think I can help you, I won't waste your time and you're not out anything but a phone call. The number's 837-7174. I'm not at work. Obviously, it's Saturday. Just leave your name on the machine. It's 837-7174. And right after this break, I'm going to give you some amazing new technologies for chronic pain and suffering that you probably have never heard about before. So don't go away. We'll be right back after this short break. Welcome back to Get Well Acadiana with Dr. Kevin. Thank you for joining me on the show today. We're discussing chronic pain and some cutting-edge solutions for pain and suffering that you may have never heard of on the show today. And before break, we were discussing that your symptoms are not what's wrong with you. Symptoms are a sign that your body sends you telling you tissue is being damaged, telling you something is wrong. And treating your symptoms is never going to fix you. And the other problem I see is that patients talk themselves out of looking for solutions because they've convinced themselves that there's no hope for them. And it's impossible for any doctor to tell you that you have to live with something. That would mean that that doctor knows every treatment available in the entire world and how your individual body is going to respond to every one of them. And that's not possible. I see chronic pain patients every single day, and I've never told someone that you're just going to have to live with this because there's no solution for you. How do I know that? I can tell them my program can't help them, but I can't tell them everybody else's program is not going to help them because I just don't know that. And no doctor should really ever say that. Now, when I say chronic pain for the purposes of our show today, I'm talking about any pain that you've had in your body more than, once every few weeks and more than, say, a month or two. I'm talking about fibromyalgia, headaches and migraines, chronic back and neck pain, shoulder and rotator cuff injuries, wrist and hand problems, knee and foot disorders, disc injuries, knee arthritis, and my all-time favorite, bone on bone. I know you guys have heard me say this on the show before. This bone-on-bone thing is such a pet peeve of mine. Guys, listen, I've now been in practice 22 years. I think I figured up the other day, I've done over 480,000 patient treatments in the last 22 years. So I've been around the block. And I hear patients at least once a week come in and say, well, my knee is bone on bone or my hip is bone on bone. Guys, y'all know I shoot straight on this show. I've x-rayed hundreds of these. I've never found one. I've never found a single patient that was told their joints were bone on bone that actually had one. I'm not saying it doesn't happen. I've just never seen one. There's always some cartilage in there that we can work with. Because here's the truth of it. If your knee or hip was actually bone rubbing against bone, you would not have walked into my office to tell me about it. That's just silly. I guess the reason they say that is because it's a very visual picture and it sounds scary. I've never seen one. I just don't think it's the truth. So That's always been kind of a pet peeve of mine. My knee is bone on bone. Well, let's x-ray it and make sure. Never found one. There's almost always a solution that we can come up with to help someone suffering with chronic pain, no matter where it's from. But the first step is you have to know that these things are not normal. It's not normal to suffer with pain. It's not a normal part of aging. Pain is not a normal part of life, and it has nothing to do with your age. It's like the guy had came in that his right knee had been bothering him, and his wife made him come in. She drug him in. He wasn't interested in coming in to get it looked at, but his wife made him come, and his right knee was really sore and inflamed and bothering him, and he was just convinced it was old age. That's what he kept saying. Oh, I'm old, doc. That's all it is. You can't help me. I'm just old. And I just couldn't get through to this guy. So finally, I said, well, tell me about your left knee. Well, my left knee's good. No problems with it. Well, sir, it's the same age as your right knee, and your left knee is fine. So it's not just age. The truth is that knee had been damaged multiple times, and he did nothing about it. And now it had developed scar tissue and inflammation and arthritis, and that's why it hurt. It had nothing to do with his age. It had to do with a lifetime of injuries that were never properly addressed. And that's pretty much standard across the board. It's not age, it's from a lifetime of damage that no one has properly addressed. Because if you ignore it, it's only going to get worse. Because typically, problems don't get better when you ignore them. If your house is dirty and you ignore it, it's going to get worse. If your children do bad in school and you ignore it, it's going to get worse. If you have symptoms in your body and you ignore them and just pop a pill, it's going to get worse. Here's the other thing about covering up your pain with medication, and this is something people don't think about often. So let's say that I have pain in my right lower back, and whenever I bend to my right, it pinches and it hurts me. So I take pain medicine so I don't feel it, and now I'm bending to the right and I'm not feeling it, but I'm making it worse. Pain is your body telling you not to bend that way. So you're further damaging those joints because now you're not feeling the body's limiting signal to, hey, don't do that. That's damaging it. And so you're actually not feeling it, so that makes you damage it worse. And we depend on these over-the-counter pain relievers way too much. These things aren't supposed to be taken for long periods. In fact, only days. Some of them are only supposed to be taken for no more than 7 days in a row. I consult patients that have been taking them every day for years. And when we look at their kidneys and liver, they have damage. And so we end up with two problems to fix. One is the original problem they've ignored, and the other one is we have to try to restore their kidney and liver damage, which of course is more difficult and expensive and lengthy. So these over-the-counter medications are not harmless. Just because you don't need a prescription for them doesn't mean that they're harmless to your body. And so you want to try to limit your use of those things as well. But what happens is that because these things work for pain and we're all busy and we've got things to do, that we would rather pop a pill and not worry about it. And I want to encourage all of you out there not to do that. And if your chronic pain keeps you from being active, let's say taking walks, let's say you used to go for a walk to exercise, but now your knee problem prevents you from doing that. Well, that knee problem has just turned into a weight problem and a heart problem and cardiovascular issues and a diabetes problem because it's preventing you from staying active. So now it's affecting the rest of your health as well, and the rest of your health can now go downhill. So this is important stuff, guys. Someone needs to figure out solutions for all this because life is just too short for that. Life is too short to suffer needlessly when solutions out there exist. And what we've done is we've taken 5 technologies for drug-free pain relief, and we've coupled them together in one program. So we don't really have to find the magic bullet here to solve your pain because there's usually not one. We battle chronic pain with this sort of multi-frontal assault, doing these 5 new technologies together in a very specific order in one treatment protocol. And this is the reason why we're successful when so many other programs have failed. Trying one thing that doesn't work completely and then going to the next thing that doesn't work, and then you go to the third thing that doesn't work. That fails because of the complicated nature of chronic pain. But if I do 5 things to solve your pain and each one of them just helps you 20%, we're all the way there. We don't have to hit a home run here. If I do 5 things and 4 of them help you 20% and one of them I would completely miss the boat on, you're 80% better. And most chronic pain patients would love to be 80% better. Most of them would love to be 30% better. But this approach, using today's best new solutions and doing them in one proven program in a very specific order based on your underlying conditions, will give you the best hope for permanent pain relief. And we're going to go through a few of those technologies right after this short break. But before we cut to break, I wanted to invite those of you that are dealing with pain, no matter what the condition is. If you have pain and you want to talk to me to see if I think that my protocols would help you, I'm doing complimentary phone consultations all this week to try to help as many people as I possibly can. And we can have a discussion on the phone about what's going on with you and my methods to see if we think they're a good fit. And if we don't, if we don't think they're a good fit, I'll be the first one to tell you. So all you have to do is call my office at 837-7174. It's Saturday. Obviously, I'm not at work. Just leave your name and number on the machine and say, I'd like Dr. Kevin to call me back Monday to see, if he thinks he can help me. And when I get some time Monday, I will call you back and see if I think that what you have and what I do is a good fit. The number's 837-7174, 837-7174. We're going to get into some of these new technologies right after this next break, so don't go away. Welcome back to Get Well Acadiana. Thank you so much for joining us on the show today. I'm Dr. Kevin. Today, we're discussing chronic pain. So in the time we have left today, because I was going to go through 5 new technologies, but I've kind of been running my mouth a little too much in these first 2 segments. So I'm going to go through as many of these technologies as I can today. And then I'm going to come back and have a second show next week to go through the rest of these technologies for chronic pain. So I have 5 technologies for chronic pain, and I'm going to give you a few of those today, and then we'll continue on the other ones next week. And yes, I understand every case is different, but generally, most people with pain have a few underlying body conditions that we see that's the same in almost every case of chronic pain. And the number one commonality I see in all patients that suffer with pain is something called fibrous adhesion. Fibrous adhesions are created from scar tissue. Now, anytime healthy tissue is injured, the body heals that injury over with scar tissue. And over time, scar tissue turns into something called fibrous adhesions. Now, if you guys could look at normal healthy tissue, and when I say tissue, I'm talking about tendons and ligaments and cartilage and joints. If you could look at normal, what's called soft tissue, if you could look at healthy tissue under a microscope, the collagen fibers would be lined up in a straight line like an interstate highway. If you could look at a ligament under a microscope, the fibers would be all lined up like Interstate 10, all in a nice, healthy row. That makes the tissue very soft and pliable and bendable and healthy and functioning normally. Now, once that tissue gets a small injury, your body's going to heal that little micro tear or that little injury over with scar tissue. And when you look at injured tissue under a microscope, it looks more like a wadded up fishnet. The collagen fibers are crisscrossed in all different directions like a patchwork. And so it would be like, instead of all nice, healthy, lined up fibers, it looks like somebody wadded those fibers up into a ball. These are called fibrous adhesions, and you can feel them under your skin. They feel like little marbles, like little tough, gristly tissue under your skin in the area that you have pain. Fibrous adhesions are full of pain receptors, and they are a source of great pain in almost all chronic pain patients. And many times what I've seen is it's not the lack of cartilage that's causing these extremity and joint pains. It's actually that the joint is eaten up with fibrous adhesions all around the joint. So I've found that that's more responsible for the actual pain part of it than it is the lack of cartilage. These knots are very tender when you rub and when you touch them. And if you guys will feel around your area of chronic pain under the skin and you feel these kind of nodules, those nodules are called fibrous adhesions, and they are full of pain receptors. And this is usually the patient that's had every kind of test and exam. They've been diagnosed with, some kind of wastebasket diagnosis like fibromyalgia or something like that, and the doctors can't figure out what's causing their pain. It's usually a result of too much scar tissue and fibrous adhesions. So how does this occur? Well, if you add up all of the very small injuries that you've had in your entire lifetime, each one of those develops a scar that will later turn into painful fibrous adhesions. Now, people oftentimes will tell me, well, doc, I've only been in like one accident. I haven't really had any traumas. I'm not talking about those kind of traumas. The average person has had 1,000 physical traumas to their body by the time they're 40 years old. And they don't realize they were traumas. It doesn't have to be a rollover accident or falling down a flight of stairs. Maybe in high school football, you were throwing and your shoulder got a little sore, and then it got little micro tears in it. Then it healed up and you were fine. And then maybe in college, you were working out and you injured that same shoulder. And it was sore a few days and then it got better. And then later on, maybe you were weed eating and that same shoulder got a little sore again and then it got better. And then you were lifting something out of your truck a few months later and it got sore again and then it got better. All of these little small traumas over your lifetime will add up to create scar tissue and fibrous adhesions in that joint over time. At one point in your life, it's going to reach a point where it becomes completely scarred up. It becomes stiff and it has a lack of range of motion, and it will start to produce significant pain in the region. And when you think back, you think, well, I've never really hurt this shoulder. But the truth is there's been hundreds, if not thousands, of traumas to your body that you didn't think was really bad. Maybe in a lower back, the same thing. Maybe you hurt it in high school sports and then maybe later in college. And then you were lifting groceries out of your car. Each time it was sore a few days and got better, and you didn't think about it as being a trauma. But later on in life, it will lead to fibrous adhesions, and fibrous adhesions are one of the biggest pain sources I see. If I could pick one thing, if you said, what's the top of the list in the last 2 years you've seen causing pain, I would say scar tissue and fibrous adhesions. So remember, we have these crisscross of collagen fibers. They look like a wadded up fishnet under a microscope, like a patchwork of fibers. These are tough, gristly, and full of pain receptors. Now, the old way of treating this scar tissue is we would manually take our thumb and we would apply pressure and do this deep tissue work. and manually press these fibers out of there. Well, first of all, that's a very painful treatment to have done. And also, what they've now found out is as you're applying pressure to this patchwork of tissue, if you slide off of that scar tissue and onto healthy tissue, you're actually damaging the healthy tissue around it. And you can make that patchwork larger by doing these manual deep tissue kind of therapies. Now, we have some advanced new technology called rapid release. The way rapid release technology works is through frequencies. So if you guys remember the old television commercial where they break a wine glass with a speaker with sound, so if I sit a wine glass in front of a speaker and I turn it up loud enough, the wine glass will shatter. But the note that you play has to match the frequency at which that wine glass vibrates, or it will not shatter no matter how loud it is. If I'm one note too high or one note too low that doesn't match the resonance of that glass, it will not shatter. So the note has to match the frequency at which the wine glass vibrates. Scientists and engineers have developed this new technology, and they've discovered the frequency that breaks down these fibrous adhesions. And so this machine vibrates at the same frequency that will break up these fibrous adhesions. And all you have to do is pass it over the fibrous adhesion for a few minutes, and this vibration, this frequency will help break down these fibrous adhesions and these scar tissues and allow them to become healthier again. It's completely pain-free. It doesn't damage the tissue around it. It only targets the fibrous adhesions, and this is a powerful new technology for reducing scar tissue and fibrous adhesions and trigger points, and it even works on people that have already had surgery. Guys, listen, you talk about developing scar tissue. Imagine if I take a scalpel and I slice through your skin, and then I slice all of the muscles off of the bone. And then I saw through the bone, and I saw through the joint capsules, and then I sew all of that back together and reattach it and stitch it all. Can you guys imagine the crisscross of collagen fibers and scar tissue and pain receptors that's present in that tissue? So rapid release is one of the most amazing new technologies for our post-surgical program. If you've already had the back surgeries or the shoulder surgeries or the wrist surgeries and you're still having pain, it is likely from a very advanced case of fibrous adhesions and scar tissue. Guys, this is a paradigm shift in the way that we treat chronic pain because almost every chronic pain patient has loads and loads of fibrous adhesions and they are very painful. And if we don't address the scar tissue, you will have a really hard time ever getting long-term relief if you keep this scar tissue in there. And so before we cut to break, I wanted to tell you that I'm doing complimentary phone consultations all this week to tell you about how our program works and listen to your individual conditions. And I can tell you on the phone if I think it's worth something looking into. And if I ever feel like I can't help you, I won't waste your time. And so all you have to do is call my office at 837-7174 and leave your name and number right there on my machine. And when I get a minute Monday, I'll give you a call and we can have a conversation and see if I think my methods might be able to help you. And if I don't think I can, like I said, I won't waste your time. The number's 837-7174. We'll be right back after this short break. Welcome back to Get Well Acadiana with Dr. Kevin. Thank you so much for joining me on the show today. We're discussing some new technologies to treat chronic pain. And before the break, I was discussing an amazing new device to treat chronic pain through reducing fibrous adhesions and scar tissue. And the second really powerful new treatment that I wanted to tell you for chronic pain today is something called dry needling. Now, I'm not crazy about the name. I would have probably named it something better than that. I mean, if you go to the average person on the street and say, "Hey, would you like to be dry needled?" I don't think very many people are going to say yes. But Dr. Fontenot and I are both dry needling practitioners. And so let me ask you a question. If I were to ask you, why do people get pain that doesn't go away? What would you think the answer to that would be? So the question I'm asking you is, what's the difference between acute pain and chronic pain? Acute pain means I smash my thumb or I stump my toe and it hurts for 10 minutes and goes away. What's the difference in that pain and the pain in your knee or shoulder or back that hurts and does not go away? What makes chronic pain not go away and acute pain go away? What's the difference in those two things? Now, this is very interesting. This gets really down to the heart of why you go on suffering day after day. Chronic pain doesn't go away. So why is that? Here's what's happening. So stick with me here. Your body's response to pain is a reflex mechanism called splinting. Splinting means that anytime your body feels pain, its automatic reflex to protect that area is to contract and spasm all the muscles and tissues around it to protect that area from further injury. So splinting is the same reason that when you smash your thumb with a hammer, the first thing you do is hold it against your body. You guys ever notice that? That's called splinting. That is a reflex. You can't not do it. It's just automatic. It's a reflex for your body. Now, your body automatically does this all over your body anywhere that it feels pain. If I feel pain in my right lower back, my body is going to splint those muscles in that area to tighten down and protect that area from further pain or further injury. So here's the problem with this. When an area of the body goes into pain and it goes through this splinting mechanism, sometimes the body will overreact and contract that area too hard. And if it contracts that area too hard, it can push the blood flow out and restrict circulation. But the blood contains all the healing oxygen and healing chemicals that it needs to go in order to stop it from hurting. So when it contracts hard enough and it pushes the blood out, it doesn't get the oxygen and healing chemicals that it needs to feel better. So it begins to hurt worse. So it contracts harder, pushing more blood flow out, further depriving it of oxygen and healing chemicals. So it begins to hurt even worse. So it contracts even harder. So it pushes more blood flow out. And now you have the downward spiral of chronic pain. That's the difference between you stumping your toe and it going away in 10 minutes and your lower back or your knee hurting you for the last 5 years. Your body's own splinting mechanism has overreacted and has robbed this painful area of exactly what it needs to feel better. It's called splinting. The area has become chronically painful. The muscles are stuck in contraction and spasm, and the body is basically just doomed to hurt worse and worse and get tighter and tighter. Now, let's introduce dry needling therapy. We can now take some tiny acupuncture needles and begin to insert them around these splinting areas, around these spasms and contractions, and it instantly reverses and relaxes this whole process. The body will begin to bring more blood to the area, more oxygen to the area, helping that area feel better. It will wash out those waste products and lactic acid buildup, bringing more oxygen to the tissue. All of the healing chemicals can begin to rush in and make that area feel better. So you begin to get this exchange of oxygen and healing chemicals to the painful area and washing out all the waste products and lactic acid buildup from the spasm. And this exchange can begin to instantly reduce pain and break this downward spiral of spasm and contraction. I have literally seen patients stand up off of the table that have been suffering in pain from just breaking this splinting mechanism. And the other thing about this, if you're one of those that's afraid of needles, these things are tiny. They're about the width of a human hair. They're right at one third the size of a mosquito bite. And so I've been in practice now for 22 years, and I've seen this help patients that I would have never thought had a chance to feel as good as they did before I did this dry needling therapy. It is a remarkable advancement. And I have three more technologies that I'm going to share with you guys next week that is going to further help you reduce your chronic pain and spasm. And so, in closing today, if you're interested in talking to me about your pain to see if I think my methods might be able to help you, all you have to do is call my office at 837-7174. I'm doing complimentary phone consultations all this week to try to help as many people as I possibly can right here in the Acadiana area not go on suffering. The number's 837-7174. All you have to do is just call and leave your name and number on the machine. I'll call you back Monday when I get to work. We can have a 5 or 10 minute phone conversation. And if I don't think I can help you, I won't waste your time. But if we can, we might just be able to get you golfing again or gardening again or hunting and fishing again, whatever activity it is that you want to be doing again. And if it hasn't gotten to that point yet, go ahead and take action. Don't wait until you get to where you can't do your activities, because it only becomes more difficult to treat the longer it goes. The number's 837-7174. Just leave your name and number on the machine, and I'll give you a call back Monday. Thank you guys so much for joining me. Have a good week.